Bermuda Cancer and Health Center is pleased to announce the charity's plan to introduce radiation therapy to Bermuda. In addition to existing cancer treatment services available on the island, the introduction of radiotherapy will close a significant treatment gap and will result in local, comprehensive cancer care services. To understand the cancer burden Bermuda faces, we can compare our cancer rates to those in the United States, a comparable jurisdiction based on similar socioeconomic factors. According to the American Cancer Society, men have slightly less than a 1 in 2 lifetime risk of developing cancer. For women, the risk is a little more than 1 in 3. Based on the current Bermuda population, we would expect nearly 27,000 people to be diagnosed with cancer during their lifetime, an astonishing number. Also an astonishing number is the number of people in Bermuda who have only basic health insurance or no health insurance at all. An estimated 18% of residents, or just less than 12,000 residents, fall in this category. And they would likely not have access to overseas radiation treatment for cancer because of the cost. So, why are we bringing radiation treatment to Bermuda now? There have been significant advances in treatment technology, such that a single machine or linear accelerator can be used to treat the majority of cancer. 67% of people diagnosed with cancer will be referred for radiation treatment. The cost of bringing this treatment to Bermuda is significant, but the benefits of having radiation therapy available locally are many, and include patients will not need to be off island for extended periods, likely staying in a hotel, perhaps alone, and incurring out-of-pocket expenses. Being treated at home means the patient will be surrounded by loved ones and caregivers, such as the nurses at PALS. Most patients receiving radiation treatment will cope well with the treatment and therefore will be able to continue to work. Palliative radiation, typically as a result of metastasized bone cancer, will help end-of-life patients to manage their pain. Employers will not need to replace an employee who has gone abroad for treatment. Pre-surgical radiation treatment can be provided to shrink tumors in advance of surgery, which can be performed locally. Treatment given locally can be provided at 1/3 of the cost of what local insurance providers are paying for the overseas radiation treatment. The savings to the healthcare costs will be $6 to $7 million each year. There are many organizations and charities which will benefit from the treatment being provided locally and have given our center their full support towards this important initiative. Local health insurers, Medical Doctors Association, PALS, Friends of Hospice, and the Bermuda Hospitals Board have expressed their support for the introduction of radiation therapy. At Bermuda Cancer and Health Center, our vision is to serve our community, building healthy lives free from cancer and disease. By working together with other not-for-profit charity partners, we will help reduce healthcare costs, provide a much-needed service for cancer treatment, and also ensure that the most vulnerable members of our community have access to treatment available locally.
I just want to add that in addition to obviously financial cost savings to Bermuda, one of the reasons why I'm so committed to this program is the emotional cost, which you can't put a price tag on. Somebody goes away for radiation therapy. They're away for at least 4 to 6 weeks, sitting in a hotel room. They're basically only required to go to the hospital maybe for half an hour per day for radiation. They don't have family support. We now know, medical science is that half the cure is mental well-being. And to be here in Bermuda with your loved ones, your family, your husband, your spouse, children, family, friends to support you, you can't put a price tag on that. And that's one of the things that when we have this radiation unit here, 99% of the people who contract cancer will be able to stay on island and have top-notch treatment.